Hi everyone, welcome back to the Nico the Vet channel on YouTube. For today's subject, I thought what we might talk about is urinary incontinence in dogs. So what do we mean by urinary incontinence? And I'm just being a little bit pedantic now, but it's important to be pedantic on this subject. People will sometimes come to me and say, oh, my dog is peeing all over the floor, and I wake up in the morning and the dog has peed on the floor overnight, particularly in the kitchen and in the bedrooms. And they refer to that as, they say she's incontinent, what can we do about it? So just to be pedantic, weeing more often or weeing on the floor is not the same as urinary incontinence. Urinary incontinence means, urinary obviously means wee. Urinary incontinence means that you are not able to hold onto the wee in your bladder, so it's leaking out and you are effectively peeing yourself and peeing your bed and peeing where you were lying. And you don't know that this is happening. Now, this is different to peeing on the floor overnight, because if you're peeing on the floor, it means that you woke up overnight in your bed and you thought, I need a wee. So you got out of your bed, you had a wee on the floor, and you got back in your bed and you carried on sleeping. So you were consciously aware that you needed to wee, and you got out and you had a conscious wee. Whereas urinary incontinence means you are leaking wee without knowing that you are leaking wee. So you've lost control over it. And so by definition, the wee will be leaking out wherever it is that you were resting, and it will leak out when you're relaxed. So you're not thinking consciously about holding on to your wee. So in human beings, with us, it happens when you're relaxed or when you're jumping or laughing or sneezing or coughing. In dogs, generally, it's very rare for it actually just to leak out of them as they're sort of walking around with the wee dribbling out. Which is much more common is you'll notice suddenly that your dog is smelling strongly of wee. You have a look around the back, around their bits, and they're wet or damp there. There may also be some urine discoloration. And then I'll say to people, go and feel the bed, go and check the bed. And oftentimes they'll go, oh, I hadn't realized, but their bed is quite wet. Whereas if the dog sleeps on the bed with you, or sleeps on the sofa, or sleeps on your lap, you'll notice that when they wake from rest or wake from sleep, that there's a damp patch there. So that's the definition of urinary incontinence. And I sort of keep saying this if you look at her, referring to the female gender. And that's because urinary incontinence is much more common in girls than it is in boys. For the simple reason that think of the urinary system as just a bladder, which is just a bag of fluid to collect urine, and then there's a tube leading to the outside world, and you wee through that. Now in girls, that tube is a very short, broad tube, whereas in boys, it's a much narrower tube and a much longer tube leading all the way around the pelvis, out through the willy and to the outside world. So just by definition in boys, there's much more resistance. It's harder to blow fluid or to push fluid along a long thin tube than a broad tube. So as you get older, and the valves that hold the tube shut, so remember the bladder's here, the tube goes to the outside. Think of it as you've got two valves holding that the tube, the urethra, the tube leading to the outside. There's two valves holding it shut. The one valve is under your conscious control. So you can think, geez, I'm busting for a wee, but I'm in my car, I'm in a traffic jam, I mustn't wee. So you can focus on saying, I'm not going to wee, I'm going to hold on to that. But there's a second valve, think of it in these terms, there's a second valve that works under your subconscious mind. So when you're asleep and in bed and you need a wee again, you're not consciously thinking about, oh, I must pinch, I must hold on. You've got your subconscious valve holding on, and that's sealing it off for you. Now that's the valve that doesn't work when you have urinary incontinence. So these dogs, when they're awake, they're not leaking wee walking around. When they're playing, they're not leaking wee, and that's because their conscious control valve, they're consciously thinking, I must hold on. But when they're relaxed and when they're sleeping, they can no longer focus on that one, so they're relying on the subconscious. And if that one's gone, then as soon as you relax, then you're going to start leaking wee. And so the valves, if you think of it, they just have to control pipes. In the girls, the shorter, broader pipe is much harder to squish and shut down. Whereas in the boys, even if the valve's not working as well as it should, because the length of the tube is longer, there's more resistance, it's less likely that wee will leak out. So I'm going to say, girls most of the time in this talk, but most of this can be extrapolated onto boys. So it tends to be sort of a middle-aged and older thing in dogs, but it can occur younger. And there is some debate about what impact desexing or spaying or neutering has on these cases. And I think undoubtedly urinary incontinence is more common in girls who have been desexed or spayed than in girls who have not. it's not to say that you've been spayed, so tomorrow you will be incontinent. And I would think if it is correlated, if it's connected with the fact that you are spayed, probably you'd expect to see the incontinence within 6 months, at the most 12 months of having had your uterus and your ovaries removed. Whereas if it happens several years later, then I think it's not directly correlated to the surgery that you've had. An interesting aside is post-spaying incontinence cases seem to be surgeon orientated to an extent, which is to say some vets have more of these after spaying girls, and some of them have fewer. And it led to a lot of research on the subject to say, well, are these guys doing something wrong? And they were observed by specialist surgeons to see if they were maybe pulling things too hard or somehow causing harm, and they can find no reason for this. So that's a trend. I don't know how significant that phenomenon is, but it is worth raising. So let's say you've gone to the vet and you've said, right, my dog is weeing in her sleep. When she gets up off the sofa, there's a wet patch, or she gets up off me, there's a wet patch, or her bed is wet. What to do about it? So I would consider incontinence in 3 categories. You get true primary sphincter mechanism incompetence, and that's where these valves we spoke about are simply just not working for one reason or another. But you also get 2 other categories of incontinence. The first one I would call overflow incontinence. And again, go back to the bladder. Imagine it's a bag, it's a repository, it stores wee that comes from your kidneys, and you sort of accumulate in the bag, gets bigger and bigger and bigger. The valves keep the tube shut, and only when you're ready to wee do you go and wee. But if you have a medical condition that makes you produce far more urine than your bladder was ever designed to hold, it means your bladder is always at a completely overfull, overdilated state, and it's just impossible for the valves, even though they're working fine, it's just impossible for them to hold back this flood of fluid, and you can then be incontinent. And so what sort of conditions would cause that? Well, anything that would make you overproduce urine. So the obvious one is diabetes. If you are diabetic, you will be weeing more often because you are making more wee, but you may be more inclined to have accidents. Let's call that urinary incontinence in inverted commas. So diabetes is one example. Any other condition which makes you overproduce wee will do the same. So for example, kidney problems or liver problems, and sometimes even calcium metabolism disorders. The giveaway if in questioning people when they say my dog's incontinent, I would ask them, is there any change in the thirst or the appetite? Are you eating more or drinking more or less or much the same as normal? Because if, for example, if you were diabetic, what we'd expect people to say is, yeah, she's drinking lots more than normal, and maybe even eating lots more than normal. Whereas in kidney failure patients, the appetite may actually be reduced. So if the appetite is normal and the thirst is normal, then it's unlikely that you have an overflow incontinence. The third category is what I would call urge incontinence, which is basically cystitis or inflammation in the bladder. And if you look at my other videos about cystitis, I'm quite pedantic about everything, really. Quite pedantic about the term cystitis. Cystitis just means inflammation in the bladder. It doesn't imply necessarily a bacterial infection. So people use the term very loosely. They say, when talking about themselves, they'll say, I've got cystitis. What they mean is that they've got a bacterial cystitis, a bacterial infection in the bladder. But other things can also inflame the bladder, like bladder stones or bladder tumors, or even idiopathic cystitis, which is we don't know why. It just becomes inflamed for unknown reasons. So whatever the cause of the cystitis, again, think of the bladder as a big bag, and it's just a big bag made of muscle. Whenever there's cystitis, irrespective of the cause, it makes the bladder wall, the muscle wall spasm, and so you've got the tube leading outside, you've got the valve trying to hold on, and because of the inflammation, the bladder wall is constantly doing this. It's sort of squeezing out, and if that valve isn't quick enough, it can't catch the wee, and you may have an accident. So when I'm exploring that possibility in people, I'll say, well, apart from the accidents that we're having and peeing in our bed and so on, is she peeing more often? Is she peeing more frequently? Is she straining to wee? And when she does wee, does she just produce a few dribbles, or does she produce a big volume of wee? Because for anyone who's ever had a cystitis themselves, they'll know that when that burning feeling in your bladder makes you feel like you need to go a lot, but when you do actually go, there's not much wee that comes out, and it's burning and uncomfortable. So if you see any of those symptoms in your dog associated with the incontinence symptoms, then you would consider urge incontinence. It just means you just get the urge to wee comes on so quickly that you don't have time to react. So if in the questioning there's no symptoms of urge incontinence, there's nothing that correlates with overflow incontinence, then almost certainly you have primary sphincter mechanism incompetence. Technically, I would always like to get a urine sample first, which I can just test in-house. It's not going to cost you a great deal of money, and we can just sort of satisfy ourselves that there is not an overproduction of urine and that there is not evidence of inflammation. So I'd like to have that just for the comfort of being sure that it is primary sphincter mechanism. But if you can't find it, by asking the relevant questions, you could make the other two causes unlikely. So let's say we've now established that you do have primary sphincter mechanism incompetence. Again, the bladder's a bag, two valves, one under conscious control, one under subconscious. So we're saying the subconscious control one isn't working as well as it should. What can we do about it? And really, there are 4 treatments that one can use for this. Probably the oldest and the most true and tried system is a medication called propylene. And what it does is it increases the tone in the smooth muscle, because the sphincter is smooth muscle. Just to be boring, you've got 3 types of muscle in your body. You've got skeletal muscle, which is the muscles in your arms and your legs that you move around your skeleton. You've got cardiac muscle, which is the obvious, it's your heart muscle. And then the rest of the muscle in your body is smooth muscle. So you have smooth muscle in the valves controlling your bladder. You have smooth muscle in your intestines, and you have some smooth muscle in your airways. That's sort of the common sites that we talk about it. Now, smooth muscle is not under conscious control, it's under subconscious control. Think in those terms. So what propylene does is it stimulates the smooth muscle, and that second valve, not the conscious one, the second valve, it just makes it work out of it. It makes it flex and flex and flex, and it makes it tighter so it's more able to hold onto the wee in the bladder. And in the same way that if you go to the gym and you pick up a lot of weights with one arm and not with the other, the arm that you're using to pick up the weights, the muscle will get bigger and stronger because you're giving it a workout. Well, the propylene gives the sphincter muscle a workout, and it gets bigger and stronger and better at holding on the urine. So what I like to do with propylene is go at the recommended manufacturer's dose, which is 2 times a day or 3 times a day dosing, to give this sphincter a constant workout, and do that for at least 3 months. Now, if it's going to work for you, it will work very quickly. Within a week, 2 tops, you should see that the leaking problem is gone. It's all over. If that's the case, great. Propylene's a drug for you. I would stay on the manufacturer's recommended dose for at least 3 months while you're waiting for this muscle to get bigger and stronger. And then, just for the sake of convenience, you don't have to do it because you don't have to try and reduce the dose because there's any way harmful to your dog. It's a pain in the bum giving medications all the time. And also you can stretch your money a little bit by using less every day. So after 3 months, you get that muscle as strong as it's going to be and as tough as it's going to be. You can start tapering down to the minimum dose that works, meaning drop the dose every couple of weeks by a smidgen. Just bring it down, 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 down until you find what works for you. So I like propylene. The only downside of propylene, it comes in a liquid and it tastes foul. If you put a drop on your finger and taste it yourself, it's very, very bitter. Dogs really don't like it. So you can just suck it up, sorry sweetie, and just squirt it in her mouth, or you can hide it in the food with something strong tasting. But I wish they would do something to improve the taste of it. An alternative to that is urine, which is basically the female hormone estrogen. For reasons there's lots of theories, but I don't think any of them are definitively proven. For reasons that we don't entirely understand, if you can add the level of estrogen, increase the level of estrogen in the body, that improves the smooth muscle sphincter function. It makes the receptors more receptive to the impulses to increase muscle tone, and that may work well for you. Pros and cons: it's a tablet which you just give once a day, so that's handy. The cons are it is a tablet that you have to give once a day. So that led some argument to the case that the act of desexing, so removing the ovaries and removing the uterus and spaying your bitch, may be correlated because they respond so well to estrogen supplementation. It's a bit like HRT, so that sort of correlates with that argument. I would say, but however, the fact that you respond equally well to smooth muscle stimulants means that it can't be purely an estrogen problem. So that's part of the confusion with treating or understanding why incontinence happens in older dogs. This is the true incontinence, because they respond to such a variety of medications which act completely different mechanisms. So the propylene works by stimulating the muscle. The estrogen works by boosting your estrogen levels, which indirectly makes the muscles more responsive. But they're very, very different mechanisms. So I think that means going back to the original cause makes that very difficult. If neither propylene or urine work for you, then there's another medication one can use, which is Enurase. Again, it acts on smooth muscles and it increases muscle tone. strangely, it was originally developed as a hay fever treatment, and I don't know who figured out that let's try a hay fever treatment in incontinent dogs, but that will often work too. It's sort of in the ephedrine family. It's my sort of third choice for no reason other than convention. I like to go through this process, and if nothing works, then supralorin, which is an implant drug, which is relatively new on the veterinary scene, can also have some success in these cases. It's an implant that you put in like the contraceptive implant injection in people, similar to sort of a microchip that you might put into the dog, and it lasts for 6 to 12 months. And again, it works on the sex hormone level in terms of making the muscle sphincters more responsive. So let's say you've got your dog on, you've tried these medications and you find the one that works well for you, and then suddenly they become a bit leaky again. What's going on in those cases? So basically you've been well controlled for months or even years sometimes, but now you're leaking again. It could be that there's been some sort of error and you thought your wife was giving the medications and she thought you were giving the medications and nobody gave the medications, or you've tapered down and the dose is too low and you may just need to make a dose correction. But ask the same questions that we asked at the outset. The biggest one being, are you weeing more frequently than normal and maybe putting in more effort than normal? And if you test the wee, is there evidence of inflammation or cystitis? And this can happen because if you think, go back to the model of the bladder being a bag of fluid with the urethra going out and the valves keeping it shut. If you have a leaky valve that's not holding the wee in the bladder, it's not stopping the wee going that way, that leaky valve will also be less good at stopping bacteria coming up from the outside world via the vagina into the bladder. So it is a two-way problem. So it's not holding the wee. If you're incontinent, you're not holding the wee in, and you're also not holding the bacteria out, so you are prone to secondary infections. Now you've got this sort of borderline bladder sphincter, which is not working quite as well as it should, but it's sort of holding on, and then you've got bacteria going up, causing spasm in the bladder, and it just gets caught short and it can't hold the wee again. So sometimes incontinence can be compounded or complicated by secondary UTIs, urinary tract infections, and those cases are actually a godsend because all you have to do is go for a short course of antibiotic, clear the infection, get rid of it, and you'll go back to the sphincter control that you had before the event. So I think these cases, surgically, there are also surgical options. A lot of them are associated with complications. They can put some sort of, if you imagine the urethra, the tube coming out, they can put some blebs of basically glue at 3 points under the mucous membrane lining the urethra, which has the effect of just narrowing it. So you've created a model in girls similar to in boys, so it's a narrower tube, harder to wee past. It hasn't gained sort of mainstream popularity. I think it's difficult to do and results are not consistent. Another option is just like in human beings with urinary incontinence, we can do a sling. So what you're doing there is you've got your bladder there with the tube leading to the outside world. If you put a sling, which you can make from muscle or nylon, and you put it under the urethra and pull it up, you now have to pee around a bend, if that makes sense. So the tube was going straight, you've now put a sling to pull it up, so you've now got to pee uphill to go downhill. And again, you've turned the girls into more of a boy model where there's just more resistance along the length of the urethra, so it takes greater pressure in the bladder to leak and to wee. So it's just less likely that you will leak or wee. So surgical options, again, none of them have really achieved a sort of a mainstream in the veterinary world, unlike in human beings, for various reasons. But I think the complication rates probably outweigh the potential benefits. So I think treating urinary incontinence is important. I mean, even if people say, well, I don't mind, the dog sleeps outside and it doesn't bother me too much, so I'd rather not treat. Well, you give some thought to the poor dog. The poor dog's not having fun either, because when you're leaking wee out, the smell is no good, and it can irritate the skin. It can irritate the skin on the vulva, irritate the skin on the legs, and you can get ulcers and inflammation, and that's usually pretty obvious when that happens, because you'll see the ulcers on the skin, usually the vulva skin, and the dogs are really bothered by it. It's sort of a stingy, burny feeling, and they'll scoot their bums on the ground and lick and chase and chew at themselves. It's just unpleasant. So even though it doesn't bother you particularly, I think you should absolutely do this for the welfare of your dog, because like you and I, nobody wants to be peeing on themselves, and you definitely want to do something about it. So relatively cheap, relatively easy and very simple to fix what can be a very, very troublesome problem. But the main issue, going back to the beginning of the talk, is understand what the symptom is. Again, people come to me and will say, I've booked in for incontinence, and then on questioning, they're not incontinent at all. So if your dog is weeing on the floor in the evenings, that is overnight or any time of the day, but consciously weeing on the floor, that's not incontinence. You must be leaking where you sleep, because you wouldn't willfully wee in your bed, you wouldn't willfully soil yourself, you wouldn't willfully soil your environment. So it's something that's happening despite your control, whereas getting up and weeing on the floor is a conscious effort. So once you've established that there is urinary incontinence, go speak to your vet, cheap and easy. If you can take a wee sample, you'll make their lives a lot easier, just to rule out anything else, and happy days. It's easy to sort out. So thank you again for dialing in, tuning in. Please check out all the other videos we have, and if you have any ideas, as always, just let me know what topics you'd like me to address. Thank you. Bye-bye.